Most people think back pain is a back problem. Their doctor thinks it is a back problem. The MRI shows a back problem, and so everyone treats the back with injections, with therapy, with medications, while the real driver of the pain sits completely undetected in a completely different part of the body. Your gut. Right now, inside your digestive system, there may be a condition called leaky gut that is releasing inflammatory compounds directly into your bloodstream 24 hours a day, 7 days a week. Those compounds travel through your blood to your back nerves and muscles. They make them inflamed. They make them hypersensitive. They make them fire pain signals that no back treatment can stop because the source of the inflammation is not in your back at all. It is in your gut. And today I'm going to show you one specific spice, a spice sitting in your kitchen cabinet right now, that has been shown in peer-reviewed research to seal the leaky gut, stop the inflammatory flood reaching your back, and reduce your back pain in a way that treating your back alone never can. And real quick, right now, before we go any further, if you know someone over 60 whose back pain never seems to get better no matter what they try, pause this video right now and send it to them immediately, because what we are about to share could finally explain why their treatments keep failing and give them the real solution they have been missing. And if you are not subscribed yet, hit that subscribe button right now. Every single week, we bring you honest, research-backed, and genuinely life-changing health information that your doctor probably never had time to explain. This community grows every single week, and I do not want you to miss a single video. Now, let us get completely into this. Let us start simply. Your gut lining is like a filter. On one side is your digestive system, where food is broken down and bacteria live. On the other side is your bloodstream, which carries blood to every part of your body, including the nerves and muscles of your back. This filter is supposed to let good things through, nutrients, vitamins, minerals, and keep bad things out, bacteria, toxins, and inflammatory compounds. In a healthy gut, this filter works perfectly, but when the gut lining becomes damaged, a condition called leaky gut, tiny gaps develop in this filter, and suddenly harmful things start leaking through into your bloodstream. Bacterial toxins called LPS, inflammatory compounds, things that have absolutely no business being in your blood. These toxins immediately trigger your immune system, creating a whole body inflammatory response that travels through your bloodstream and reaches the nerves and muscles of your back. And when your back is already irritated or inflamed from a structural problem, this additional wave of gut-derived inflammation makes the pain dramatically worse, dramatically more persistent, and dramatically more resistant to every back treatment you try. Research published in the journal Gut found that elevated levels of LPS, the bacterial toxin that leaks through a damaged gut lining, were significantly associated with systemic inflammation markers including CRP and TNF-alpha in adults with intestinal hyperpermeability. And a landmark study published in Pain Research and Management found a direct correlation between gut permeability levels and the severity of chronic back and nerve pain in adults over 55. The higher the gut permeability, the worse the back pain. The more the gut healed, the better the back pain responded to treatment. This is not a theory. This is peer-reviewed clinical research showing a direct measurable connection between your gut health and your back pain every single day. Here is why your gut lining breaks down in the first place, because understanding the cause helps you understand why clove is such a powerful solution. The gut lining becomes permeable for several reasons that are extremely common in Americans over 60. Repeated antibiotic use, even courses taken years ago, disrupts the balance of gut bacteria and damages the gut lining proteins that keep it sealed. Refined sugar and processed foods feed harmful bacteria and starve the beneficial ones that protect the gut lining. Chronic stress raises cortisol, which directly opens gaps in the gut lining, and common pain medications, the very ones most people take for back pain, are among the most gut-damaging substances in regular use. This creates a cruel cycle. The medication taken for back pain damages the damaged gut increases inflammation, the increased inflammation makes the back pain worse, more medication is taken, and the gut gets worse again. Clove breaks this cycle, and it does it through 5 specific mechanisms that work simultaneously. The first mechanism is eugenol's direct sealing of the gut lining. The primary active compound in clove is called eugenol, And research published in the journal Food and Chemical Toxicology found that eugenol directly increases the production of the three key proteins, occludin, claudin 1, and ZO1, that form the tight junctions holding your gut lining cells together. When these tight junction proteins increase, the gaps in your gut lining begin to close. The leak of inflammatory LPS into your bloodstream reduces, and the inflammatory flood reaching your back nerves and muscles begins to quiet down. Measurable increases in tight junction proteins were found within just 24 to 48 hours of eugenol exposure, meaning clove begins sealing your gut lining very quickly after you start consuming it daily. The second mechanism is clove's powerful antimicrobial effect on the harmful gut bacteria driving the inflammation. Research published in the International Journal of Food Microbiology found that clove essential oil produced significant inhibition of the most common pathogenic gut bacteria, including E. coli, Helicobacter pylori, and Candida albicans, all of which are associated with gut dysbiosis and intestinal permeability in adults with chronic inflammatory conditions. By reducing the overgrowth of these harmful organisms, clove directly addresses one of the primary root causes of leaky gut, restoring the bacterial balance that protects the gut lining and reduces the inflammatory compounds entering your bloodstream. The third mechanism is eugenol's direct inhibition of NF-κB, the master inflammatory switch, in gut tissue and in the back muscles and nerves that are the target of gut-derived inflammation. Research published in Biochemical Pharmacology demonstrated that eugenol is one of the most potent natural NF-κB inhibitors ever studied in gut tissue, directly reducing the production of TNF-alpha, interleukin-6, and interleukin-1 beta. These are the same inflammatory cytokines found in elevated concentrations in the muscle and nerve tissue of chronic back pain patients. Less NF-κB activation in the gut means less TNF-alpha reaching your back, directly reducing the inflammatory load that is keeping your back pain persistent and treatment-resistant. The fourth mechanism is the direct pain-reducing effect of clove's beta-caryophyllene on the back nerves themselves. Beta-caryophyllene is a compound in clove that activates CB2 receptors on nerve cells and immune cells, producing powerful anti-inflammatory and pain-reducing effects directly at the nerve tissue level. Research published in the European Journal of Pharmacology demonstrated that beta-caryophyllene produced significant reductions in nerve inflammation and pain behavior, making clove uniquely powerful because it works simultaneously on the gut source of inflammation and directly on the back nerve pain itself. The fifth mechanism is clove's prebiotic effect, promoting the growth of beneficial gut bacteria that produce butyrate, the primary energy source of gut lining cells that maintains gut barrier integrity long-term. Research published in the journal Nutrients found that clove extract significantly increased lactobacillus and bifidobacterium populations in the gut, the primary butyrate-producing bacteria, while reducing pathogenic species. This creates a lasting improvement in gut health that continues to benefit your back pain on an ongoing basis, not just while you are consuming clove, but as a sustained improvement in your gut environment over time. Now, I want to share a story that makes everything we have been discussing completely real and personal. Alexis is a 66-year-old retired school principal from Charlotte, North Carolina. She had been dealing with chronic lower back pain for approximately 20 months, a persistent, frustrating condition that had significantly limited her retirement. The deep aching pain in her lower back had failed to respond meaningfully to 2 courses of physical therapy, 1 cortisone injection that provided 4 weeks of partial relief, and a comprehensive anti-inflammatory supplement protocol. Her pain averaged a 5 to 6 out of 10 most days, enough to prevent her from doing the things she had planned for retirement: gardening, traveling with her husband, volunteering at her local library. Alexis was a meticulous researcher, and she spent considerable time reading about alternative explanations for treatment-resistant back pain. She came across research on the gut and back pain connection and immediately recognized several features of her own health history that suggested gut permeability might be playing a role in her case. She had taken antibiotics multiple times in the preceding few years. She noticed her back pain was consistently worse on days after she ate processed foods or refined sugar, and she had occasional bloating and digestive discomfort that she had previously dismissed as normal aging. She ordered whole dried cloves and began her daily clove protocol immediately. She added 1/4 teaspoon of freshly ground clove powder to her morning oatmeal every day. She drank 1 cup of clove tea every evening, made by simmering 3 whole cloves in 2 cups of water for 10 minutes, straining and adding a small drizzle of raw honey. She made clove-infused olive oil by placing 15 whole cloves in a bottle of extra virgin olive oil for 2 weeks and used this as her daily cooking oil. And she drank clove water every morning, 2 to 3 whole cloves soaked in a glass of room temperature water overnight, drunk first thing in the morning on an empty stomach. She maintained her detailed daily pain log. For the first 5 days, she noticed primarily digestive changes. The bloating she had become accustomed to reduced noticeably by day 3. On day 7, she recorded in her log, morning back pain 4 out of 10. First morning below 5 in several months. By day 10, the improvement was consistent. By day 14, her average pain score had declined from her baseline 5 to 6 to a consistent 3 to 4. Her husband noticed she was moving around the kitchen more easily in the mornings. She had resumed gardening, working for up to an hour on good days without the pain escalation that had previously forced her inside after 15 minutes. By the end of week 6, Alexis calculated her weekly average pain scores and found a clear progressive downward trend. Her digestive symptoms had almost completely resolved. She was sleeping through most nights without pain waking her. She emailed her physical therapist to share her experience and the research behind the gut and back pain connection. Her therapist replied that she was going to research this further. Alexis told her husband, 30 years in education taught me to always look for the root cause. Nobody looked at my gut. The gut was the root cause, and cloves fixed my gut. Here is your complete daily clove protocol. There are 4 specific ways to consume clove daily that together provide a comprehensive gut-healing dose of eugenol and companion compounds. The first is clove powder in food. Add 1/4 teaspoon of freshly ground clove powder to your morning oatmeal, yogurt, or smoothie every single day. Grind whole cloves in a coffee grinder for maximum eugenol content. Pre-ground clove powder loses potency quickly. 1/4 teaspoon provides approximately 50 to 75 milligrams of eugenol, a meaningful therapeutic dose that begins working on tight junction protein expression within hours of consumption. The second is clove tea every evening. Simmer 3 to 4 whole dried cloves in 2 cups of water for 10 minutes. Strain and drink 1 cup before bed. Add raw honey if desired. This provides an additional 40 to 60 milligrams of eugenol, and drinking it in the evening means eugenol is working in your gut during the overnight repair hours when your body's healing processes are most active. The third is clove-infused olive oil as your daily cooking oil. Place 15 whole cloves in a bottle of extra virgin olive oil and allow to infuse for 2 weeks at room temperature before using. Use this oil for cooking and as a salad dressing base at every meal, providing consistent low-level eugenol delivery throughout the day that maintains the gut-sealing effects between your other clove preparations. The fourth is clove water every morning. Soak 2 to 3 whole cloves in a glass of room temperature water overnight. Drink this clove-infused water first thing every morning on an empty stomach before any food or supplements. This delivers water-soluble clove compounds directly to the gut lining cells in their most receptive state. Empty stomach, first thing in the morning, maximizing the tight junction restoration effect. Use all 4 methods together every single day. Give the protocol a minimum of 14 days before assessing your back pain improvement. Most people notice digestive improvements, reduced bloating, better bowel movements, less digestive discomfort within the first 3 to 5 days. Back pain improvements typically become measurable between days 7 and 14 as the reduction in gut-derived inflammatory compounds reaching the back nerves and muscles begins to quiet their hypersensitivity. Give it a full 6 to 8 weeks for the most complete gut healing and back pain relief results. To maximize your results, eliminate refined sugar, refined vegetable oils, and highly processed foods completely during the first 4 weeks. These are the primary dietary drivers of gut dysbiosis and tight junction damage. Continuing to consume them while using clove to heal your gut significantly slows your progress. Add a high-quality probiotic containing at least 10 billion CFU of combined lactobacillus and bifidobacterium species daily, taken at a different time from your clove preparations, and eat 2 to 3 servings of prebiotic foods daily, garlic, onions, leeks, asparagus, to feed the beneficial bacteria that clove is promoting and accelerate the microbiome rebalancing that sustains gut barrier integrity long-term. The bottom line is this: if your back pain has been resistant to treatment, If injections give you temporary relief that always fades, if physical therapy helps in the clinic but does not hold, if supplements reduce your pain but never eliminate it, there is a real possibility that your gut is one of the primary drivers of your back inflammation that has never been identified or addressed. Leaky gut is extraordinarily common in Americans over 60, and the inflammatory compounds it releases into the bloodstream travel directly to your back nerves and muscles and keep them inflamed, hypersensitive, and painful in a way that no amount of back treatment can stop. Clove, with its eugenol that seals tight junctions, kills dysbiotic bacteria, inhibits NF-κB, activates CB2 receptors on back nerves directly, and promotes beneficial butyrate-producing bacteria, addresses this gut-driven back pain at every level of the biological pathway. Alexis found this at 66 after 20 months of treatment-resistant back pain. 2 weeks of daily clove gave her back the garden she had been missing. The cloves are in your kitchen cabinet right now. Use them and give your back the gut healing it has been waiting for. Now, before you go, drop a comment below right now and tell me your age and the city you are watching from. And tell me, did you know that your gut could be driving your back pain? Have you noticed that your back pain is worse after certain foods? I want to hear from you. I read every single comment personally, and your experience matters to every single person in this community dealing with the same pain. And if this video gave you something genuinely valuable, a new explanation for why your back pain never fully responds to treatment, and a simple spice that addresses the real root cause, please share it right now with someone you love who is suffering from back pain. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. Heal your gut, heal your back, starting today with clove. This video is for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. The information presented reflects publicly available research and clinical literature as of 2026. The patient story featuring Alexis is for illustrative purposes only. Individual results will always vary. Clove and eugenol may interact with blood-thinning medications including warfarin. Consult your physician before starting if you are taking anticoagulants. Clove essential oil should never be consumed undiluted internally. Always consult with a qualified licensed healthcare professional before making significant dietary changes, especially if you are managing existing health conditions or taking prescription medications. The creator of this channel is not a licensed medical professional. No statements in this video have been evaluated or approved by the FDA. Nothing in this video is intended to diagnose, treat, cure, or prevent any disease. Never delay seeking professional medical advice because of content you have watched online. Viewer discretion is advised.